Let's talk about pain following breast surgery. Whether it's for breast cancer, including a lumpectomy, a mastectomy, with or without tissue expander placement, an augmentation, a reduction, a reconstruction, and the list goes on, it's very common to get pain in the chest wall as well as the upper back following these surgeries. But you don't have to suffer. There are very basic stretches and exercises that can help you with mobility and pain reduction following these surgeries. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. So stay tuned for my phase 2 exercises in order to help you reduce pain, improve mobility, and feel better faster. As with all exercise programs, make sure to clear them with your own medical team, particularly if you have any spinal metastases, as there are some rotational components included with these exercise programs. Thank you for joining me for this video on the phase 2 exercises in order to reduce upper back pain and chest wall pain following any type of breast surgery. So if you've completed phase 1 and you're ready to move on to phase 2, we're going to start with a more aggressive version of a stretch from phase 1. So you're going to lay on your side with the most painful side up. So I'm going to lay here. I'm going to put my hand behind my head, and with my knees bent, I'm stabilizing my low back, and now I can rotate a little bit further back in order to increase that rotation, stretch, and motion of my upper back. Keeping my legs stacked one on top of the other stabilizes my low back to ensure that the mobility I'm looking for is coming only from my upper back and chest wall. And if it feels good, you can hold for 5 to 10 seconds and then come back to center. Straightening your arm increases the lever arm and makes the stretch a little bit more aggressive, but you will have to use more muscles in order to hold your arm up. So this may be too much for some people. About 5 to 10 of this exercise should be sufficient in starting to stretch your upper back. Now let's move on to the next exercises. Now for our next phase 2 exercise, we're going to do it against a wall in order to stay in the right position. So in this case, our affected side, which was my left side in the prior example, goes next to the wall. So I'm going to use my towel roll to protect my knee. I'm going to put my left knee down on the towel roll, and my right foot is going to go up into a 90-degree plane in order to help me maintain my balance. I'm going to look straight ahead and pull my belly button in order to stabilize my low back. Here is the wall. My left arm is against the wall with my palm facing out. Now you actually don't want to touch the wall. You want to hover just 1 inch away from the wall. So what I'm going to do is try and raise my hand up right against the wall. As I get straight up, I'm going to flip my hand around and go all the way back down. And then I'm going to come back, flip my hand, and come down. This is a pretty big stretch in our chest wall. So just do what you can, nice and slow and controlled, in order to get that mobility of the upper spine. This will also help with core stability in order for you to maintain your balance. You can do 5 to 10 of these and see how you feel before moving to the next exercise. I just want to show you what this exercise might look like from a front view. So again, you can see I'm about 1 inch away from the wall. My thumb is in front of me with the back of my hand facing the wall. My belly button is pulled in, and I'm going to raise up, hover right near the wall. As soon as I get straight up, my hand rotates and my upper chest is following my hand. And then we slowly come back. And again. And back. Make sure you're going slowly and safely through this range, as it can be a very aggressive stretch for both your chest wall and your upper back. For the last of our exercises, we're going to be doing a postural strengthening and stabilization technique that's usually harder to perform as it requires a lot more control of the muscles of the upper back and shoulder blade itself. So I'm going to turn around and show you an example of what this looks like. But what you want to do is stand about 6 inches away from the wall with your feet shoulder width apart and knees slightly bent in order to maintain the best posture possible. So we're going to turn around. We're going to place both hands on the wall with our elbows bent. And if our left side is still the affected side, we're going to slide the arm up the wall, pull the arm back, place it down, down, up, off the wall a few inches, down and back. And because this is such a great stabilization exercise, it's not a bad idea to alternate arms and work both of them. What this looks like from the side. Nice tall posture, belly button pulled in, hands flat against the wall, elbows just off the wall. Slide up, pull back, down, slide down. Up, off the wall, just an inch or two, down, slide down. Thank you for joining me for these phase 2 exercise routines for pain in your upper chest wall and upper back following any breast surgery. Please remember to discuss all of these exercises with your own medical team to make appropriate adjustments as necessary.